Here we are at day 2 at Arab Health, and as you look around, I would say our booth is the most popular one, of course, and we've got many more fireside chats, panel discussions, and a very special presentation which is coming up now. Thank you to our stage team for assessing the stage and setting the scene for our next presenter. You may recognize him from COP28. We like to think of him as one of our very famous doctors amongst our groups, and he's one of our key thought leaders. We are very honored that he's taking the time out of his very busy schedule to join us today. The next presentation, we're looking at wastewater analysis, the impact on healthcare. And who better to take us through this than Dr. Wael Alamin, the Medical Director of M42 Healthcare. Please do give it up to Dr. Wael. Over to you, Dr. Wael.
Thank you very much for the kind introduction. And at 11:30 in the morning, most of you wouldn't be thinking about wastewater. However, I'm pretty certain when you woke up, at least most of you would have gone through a certain routine that involves a number 1, probably a number 2, or possibly brushing your teeth. Yeah, and some people go for a number 4, something called a shower. So I think going through that routine, though, exactly like you're sitting here at 11:30 at Arab Health, you haven't gone through the soul of actually what does wastewater have to do with health and Arab health. And I start by looking at definitions. Health in itself as a word. In Latin, the root is actually sanit and sanitation. So when we say someone is insane, yeah, so basically he's unhealthy. It doesn't mean anything else. And then we think about sanitization, which is bringing up health to people. But the word and the etymology of it has changed over time to make sanity crazy for someone doing the type of work that we do. And insanity still means unclean rather than unhealthy, which is actually not accurate. Now, moving to sanitation timelines, humans, in theory, have existed in groups for hundreds of thousands of years. But it's only been about 4,000 years ago that we started thinking about sanitation. About 4,000 years ago, and actually not far away from where we are today. It started in the Mesopotamian Empire, the Persian Empire, in the Indus Valley, and actually quite recently it was realized that the Latin American, in Peru, they also had sanitation. They had proper sanitation with pipelines, with water. The most famous example, though, is one in Scotland. And in Scotland, in Skara, there were they used a very intelligent system whereby they had toilets or latrines that were dug underneath the waves, and the ocean water came in from the North Sea and wiped away, took away all the waste that we produce. At around 800 years AD, the Romans came about, and they're quite famous for what they did with sanitation. And with what they discovered or did at the time in terms was considered an engineering feat. They built something called the Cloacae Maximus, which took all of the waste of Rome from Rome to the river Tiber. And that is one of the reasons why the Roman Empire became great. So greatness and waste were always intertwined, how we deal with our waste. And after that, after the Roman Empire, we went to something called the Sanitary Dark Ages, whereby there were a lot of wars and people started not well versed as to how to take care of their waste and how they do it. And that was the time where a lot of the waste was either on pots or on holes directly without proper sanitation and driving it into waters. And that's, buildings started going up, and people used to throw their waste out of the windows. And that's the word that they used to say is hagaloo. And that's where the word loo comes from, because you'd be someone would shout, hagaloo, and they throw it. So you have to ditch it, otherwise it ends up in your head. So that was part of the Sanitary Dark Ages. But that coincided with a lot of infectious diseases. So if you look at the infectious diseases of the time, whether it was pandemics, whether it was ongoing diseases, diarrheal diseases, cholera, a lot of it was associated with all of this lack of sanitation that we have. 1800, or on the towards the 19th century, a lot of the big mega metropolis started forming. New York, Chicago in North America, but the most famous one was in Paris, and another one in Belgium. We'll come to that later. So at the time, the big metropolis were forming, massive populations of people were forming, and they needed to realize and identify ways of removing all of this waste because there were a lot of illnesses happening. And that was a time of great enlightenment, both in healthcare, science, but also in the architecture and engineering of waste and wastewater. Then we discovered the waste treatment processes, whereby not only were we able to separate waste from humans, we looked at ways of making waste safer. We looked at ways of making waste much more usable with regards to fertilizers and other productivity. And there were jobs created around waste, and a lot of jobs were actually created around waste. In other parts of the world, they used to call them, I think, the midnight men, because the only way they can work, because the rich people didn't want them, they used to call it midnight soil, and the people who worked on it, they were called the midnight men. They can only work at night because the rich people wouldn't want to be seen around or close to all of this waste and feces. And then we ended up at an age of process development, whereby we ended up with Ford generating the cars, but we also ended up with a lot of sanitation plants, whereby a lot of waste went to central plants, and these central plants moved the waste, the sludge, and started producing a lot of it. And towards the 1970s, the process was so unrefined that it became industrialized, whereby we all take it for granted today. We all sit, hopefully, in a bathroom. We press either the high flow or the low flow button, water comes, and it goes away from our sight. But we don't take into consideration what happens to this and what sort of information we can carry with this. Now, the Romans knew exactly what this is. Has anyone seen this before? So any cover is called a manhole, isn't it? And the manhole is actually called the manhole of Cloquet. And Cloquet, the plural of which is cloci, means the one opening, and that's sort of a scientific term for the orifice from which all waste comes from non-mammals, so non-placenta mammals. They only have one orifice for both water waste and solid waste, so both urine and feces. But in Roman times, this was called the oracle of truth. You can get all the truth from a manhole. So the amount of knowledge that one can get from that piece of information was known at the time at the Roman Empire. And that's why they called it the oracle of Cloquet, or the manhole of Cloquet. So, and oracles and stories were formulated around this, yeah? If you ever wanted to get, including people were using it to figure out if their husbands were cheating on them or if their partners were asking questions, they used to go to the manhole of Cloquet. It was one of the main functions of this. So, and if you think about a lot of where we live today, we're in a big metropolis. Yeah, Dubai is a massive metropolis. And if you think of this as a human body, we secrete waste, and waste comes from us in different forms, congregated. And exactly the same like a human body, there's exposure. We're all exposed to the foods we eat, to the air we breathe, to all other environmental variables around us. And we metabolize all of that. Yeah, we make use of it as an energy. And then apart from that, it either makes us better or it makes us worse. But that is what a living creature is, isn't it? So we are actually like small organs, or even less, we're like small cells in this big metropolis, whereby we all together formulate, we think about what we build, but we don't think about what we produce. And like any other organism or creature, we might be causing poor health. And since in 2019 November, I think we all came around, we all remember the day very well. Each of us probably remembers where they were the last time they were told not to leave the house today. And at the time, some of us were working on something called wastewater-based epidemiology. So we started that work at around January of 2020, looking at wastewater as a source of information because it is a very effective way of looking at population health without being too intrusive. And if you imagine at the time there was a lot of testing, those of us living in the UAE had to be tested more or less weekly. Some of us had to be testing more often than that. The question was, how do I gain more information without causing a lot of disruption, which is cost effective, without it being intrusive in people's lives? So we said, okay, we have a lot of information in wastewater. People poo, and there's a lot of molecules we can look at. So why not attempt to identify these molecules using the standard methods that you would use? We went on to automate it, to make it a very high throughput method, and then we went on to look at history. I love history. So the question is, that came across our head is, who else has done this? And then you go back to the essence of medicine, the godfathers of medicine. They actually did something very similar. The most famous of whom is a certain John Snow. So John Snow was a public epidemiologist working at London at the time. And during his work, there was a cholera outbreak. And the cholera outbreak was associated with a certain water pump called the Broad Street pump, a little bit in central London. And using simple tools of epidemiology, he was able to identify the risk and convince people to attenuate the risk by closing that water pump. And when I mention Jon Snow, the first thing that comes to people's mind is a certain different Jon Snow, who's a character in the Game of Thrones, I think, but mine is different, who's a little bit earlier. So going back to what the work that we're trying to do here is, not only do we, as a group, secrete molecules, we consume molecules, so we can measure the amount of alcohol that a city consumes. We can measure the amount of caffeine that a whole city consumes. We can measure the amount of toxins that we can produce as humans that affect the waste. And one might say, actually, why would this matter? Why on earth would you, apart from being insane, spend your days doing this? Yeah. So I think part of it, we're growing at a pace that is non-sustainable in terms of other monitoring, in terms of public health, in terms of identifying solutions. If we decide to test each and every single person all the time to instigate policies of where to spend money, and money is a finite amount, we can either spend it on public health initiatives or parks or big billboards, but we have to justify and we have to have evidence for the decision makers to allow them to reach that conclusively. We also need to have very rapid alert systems for anything like the pandemic that happened. And it's, as I said, for example, since 1950, polio, as a high-risk pathogen, it's an enterovirus, has always been monitored in wastewater. And the value of this came in 2013, when the Syrian civil war started. There were migrants from Syria moving to different countries, whereby it was identified that we have what we call not a wild polio vaccine virus. It was a vaccine-derived polio identified in wastewater in certain cities. And just last year, in both New York and London, they've identified the same strains of polio in the wastewater, representative of the population, and setting up alerts and vaccination programs to assert something that we're trying to get rid of in terms of rollback polio. So, as I said, we can monitor the wastewater for pollutants, and there's so many of them at the moment. We can monitor it for disease trends. We can monitor it for illicit drugs use. We can monitor it for communicable diseases. And it's quite cost effective and quite efficient for the populations. There's a lot of science in the background. You can actually identify how healthy a portion of a city is. We did an experiment a couple of years ago looking at different places whereby areas of low affluence and high influence and compared them to each other. And you can actually identify the patterns that you can get in wastewater by looking at that. So in Abu Dhabi, I'm not the only insane person. I work for an organization that I can describe very much as they trusted me, and they gave me told us, let's go and build this lab that does a lot of surveillance for all the stuff that I just talked to you about. And it was supported by the government of Abu Dhabi predominantly, and our employee M42 went over with a vision and carried it over, and it's currently a collaboration with Abu Dhabi Quality and Conformity Council, the government of Abu Dhabi, and M42. So we've established a lab. We've worked on developing a lot of robotics and high throughput in that lab, and we worked with our teams for making sense of the crazy amount of data that we produce. So there's a lot of scientists standing at the back over there who are data scientists who work with all of the data that we produce. So it was a fantastic project that we took from ground to the building to the robotics in 12 months, to testing and analyzing and producing data. So the facility that we work on focuses on delivering data-driven insights. So as I said, we test for more than 1,400 analytes on multiple locations of all cities every single day, with a turnaround time of less than 24 hours. So we used a lot of molecular methods in healthcare. We're using mass spectrophotometers. We're using a lot of different technology that you wouldn't see in a lab like this or in a clinical lab. And all of that data needs to make sense. And I keep telling people that intelligence is divided into real intelligence and artificial intelligence. So unfortunately, I have to depend on the artificial bit of the intelligence to make sense of the real data that we generate. And we have some really smart people who make sense of the data. And a lot of the work we also do involves innovation and development, because we have a role and responsibility to pass the knowledge, to create know-how in this lab. So within only 8 months of operation, so the lab was unofficially inaugurated on the 13th of April of 2023. We submitted some of our work to the largest organization that does this type of work, called CTAC, which is the Society of Toxicology and Chemistry in North America. And we were happily surprised that it was all accepted as oral presentations like the one we're giving today, whereby in 6 months, we've actually started generating a lot of information and knowledge and data. And it involves a lot of ingenuity from I cannot take all the credit. There's a massive team supporting me on the background, a lot of scientists and a lot of really hardworking people. So the work ranges from biological identification to stuff like phages, which are small viruses that infect bacteria. And we just ask questions. Why? Why does this E. coli survive this harsh environment? If you think about what you flush in your toilet, someone's flushing oil, someone's flushing domestos, someone's hypochlorite, someone's flushing antibiotics, someone's eating antibiotics, someone's having hormones. Yet all of these bugs are able not only to survive, but to thrive. And we are trying to understand how this is done, because we're certain that we'll identify tools for them to answer each other, because that's how things happen. Just like the discovery of antibiotics was random, but it was discovered from a bug, and how other bugs interact with each other. So one was a fungus, the other was a bacteria, and the fungus was producing a molecule called penicillin to kill the bacteria. Yeah, so we have to understand these interactions, because actually 80% of the medications we take today were actually products from the environment. Whether it's your antibiotics, whether it's your chemotherapy, whether it's your hormones, whether it's your steroids, whether it's your insulin. Even the insulin that started as an injection, we took it from cows. Yeah, bovine insulin and porcine insulin. So we have to look at what's around us to find solutions. We're not gonna, despite of everything else, and we know so little from what we have. So the lab, as I said, has a lot of technology. We've got a lot of robotics that we developed in-house. We're using a lot of digital technologies, whole genome sequencing, digital droplet PCRs, so stuff that you wouldn't attribute to a lab dedicated for just looking at sewage. So we look at pharmaceuticals, we look at the population. A great thing happened in the late 1970s, which was the discovery of the oral contraceptive pill, which has liberated a lot of people and brought people into market, the other gender into the market workforce. However, with that, We also know that the molecules that they have is the oral contraceptive pill, for example, is a combination of estrogen and progesterone. And we know that that has downstream effects in other creatures, the fish changing their gender, all the rest of that. So we're also trying to look at that and try to support governments to mitigate those risks that are unseen to the rest of us. So we look at the heavy metals, we look at the semi-volatile. So what we look at is quite a wide array, and we do that daily on a lab that was developed by people in this country predominantly, and we take pride in in saying that no one else at the moment has such a wide array. I know there's another lab being built somewhere else in Europe, but hopefully we'll be able to collaborate with them and add to each other. So I'll close with a very. I said I'm going to come back to Paris later on, and all of us would have read to Victor Hugo, Le Misérables. Yeah. So Victor Hugo, apart from being a fantastic author, was the mayor of Paris. Yeah. Not only was he the mayor, he was responsible for the sewage systems in Paris. And the book, chapter 2 on Les Miserables, most people just saw the play but didn't read the book. But chapter 2 is actually called The History of Sanitation and Sewage, on that book. On chapter 2, he has a very beautiful statement that says, the history of men is reflected in the history of the sewers. It has been a sepulchre. It has served as an asylum for crime, cleverness, social prostate, the liberty of conscience, thought, theft. All that the human law persecute or have persecuted is hidden in that hole. So I'll end up with that from Victor Hugo, and I thank you very much for the time that you spent listening to us. Thank you very much.
Thank you so much, Dr. YL. We can't possibly allow you to leave the stage without opening it up to our very enthusiastic audience. We've only got a few minutes. So have you got any questions that you'd like to put to Dr. YL while you have him here in person? Dr. YL, you have a gentleman there. Oh.
Thank you. Dr. YL, thank you so much for the presentation.
Sorry, if you hold the mic right the way up. Yes, absolutely, that's perfect.
I really enjoyed that presentation, and we were lucky enough to be involved in the project for the wastewater analysis. One of the questions that I wanted to ask you, were you able to integrate any of the AI functions to develop predictive model controlling for any diseases or potential outbreaks? I mean, I saw some of the studies that you did, but the potential here in terms of predictive model controlling is unbelievable, especially when I know there was some studies done during the COVID time where you could pre-locate certain clusters, which could help on the preventative side. But have you taken that a step further to look at any other potential outbreaks? And I know you mentioned polio, but I think the amount of data that you guys are grabbing at this point should be unbelievable, and you could look at both the social aspects and the medical aspects of it. So if you could elaborate on that, I'd really appreciate it.
So modeling is very important for what we're doing. And you've correctly alluded to the COVID pandemic and utilizing it to predict outbreaks. So we know that you get signals in wastewater about 7 to 10 days prior to the reflection in the community. And that is done based on continuous monitoring, and you look at the trend. So to model, there are several models that we have actually started working on. The most common one is based on, let's just call it a modified SVC chart, variance chart, whereby you look at a funnel sort of modeling. But what is more interesting to us at the moment is looking at interactions much more. What we're seeing is the effect of an effect and effector process, whereby actually I might be able to see a virus, let's call it virus X. How does that interact with the public health records? So that's other work that we're working on. We're trying to link all of the data that the Public Health Abu Dhabi has, whereby we get all the alerts that are submitted to them. So for example, they have a patient who has traveled in from country A, and there's a non-event, let's say Ebola is mentioned, for example, yeah?
Now, Dr. YL, I'm going to request you to keep your conversation off stage with our gentleman because unfortunately we have run out of time.
Oh.
But you are with us for a little while longer,
I am,
yes?
yeah.
And he's super approachable. I want to say Dr. and Professor YL. I mean, this gentleman has many illustrious titles. Please do continue this conversation off stage. We are going to continue with our day of programming. Please, ladies and gentlemen, give Dr. Professor YL a huge, huge round of applause. Thank you very much.